Hello, I'm Dr. Mark Mcilwain, a candidate for the Dental Board of the state of Alabama, coming to you today to talk about the issues that will affect dentistry in Alabama for the next 5 years. Issue number 1, scope of practice. Every dentist in Alabama, by education and practice proficiency, gains the ability to offer a broad range of procedures for their patients. When I was a general dentist in Tuscumbia, Alabama in 1983, I placed my first 2 implants. They were Calcitech integral implants, and I put them in a patient to build a bar. We built the bar, they had a denture that snaps in, and that patient has been happy with those for the last 30 some odd years. Also during that time, I sedated many patients for small procedures in the office. This was in keeping with the good training given to me by Dr. Tom Jones at the University of Alabama School of Dentistry. I think that dentists need to be able to do the procedures their patients need, and therefore the scope of practice will continue to change. I think that dentistry needs to supply good education and practice proficiency so that we can do these procedures for our patients and help them in their lives. Issue 2, sedation and anesthesia. Dental anxiety is the primary reason most patients avoid dentistry. It is my belief that sedation by all routes is a necessity if dentistry wants to conquer procedure anxiety. Safe sedation and anesthesia can be in the armamentarium of all dentists who master the education and proficiency required. Just like I said a while ago, when I was a general dentist in Tuscumbia, Alabama, some 30 years ago, I was proficient in IV anesthesia and IV sedation for my patients. During this time, I was able to safely take care of patients and found that many patients did not seek dentistry because of anxiety. As a matter of fact, the American Dental Association believes that over 50% of the people who have dental insurance do not seek dental care because of anxiety. This is the major impediment to care. In Alabama, it's not access to care because of the ability of dentists to see patients. It's anxiety that causes the greatest impediment to the access of care. This is an important procedure, and I will do everything in my power as a board of the dental examiners to make sure that we have proficiency in anesthesia and sedation in Alabama and that we administer it safely to our patients. Issue 3, expanded duties. The Dental Practice Act of Alabama gives broad allowable duties to assistants directly supervised by their employing dentist. The Alda White paper authored by Drs. Ingram and Walker outlined the issue. I believe Alabama's unique preceptor hygiene program gives us an opportunity to create an educational module for licensed hygienists to administer infiltration local anesthesia under the supervision of their employing dentist. The rush to have EDAs, EDDAs, and EDFAs, expanded duty function assistants, those rushes to do that were mainly predicated by the fact that during the time the Affordable Care Act was being written, there was much concern about access to dentistry for patients. The Kellogg Foundation and the Pew Foundation pushed this in many states, but we all must remember that in Alabama, we have the unique preceptor hygiene program that allows us to expand the duties of hygienists with modules that we add for training. The Dental Practice Act already allows fairly broad activities of assistance in our offices under our direct supervision. And with the addition of the ability of hygienists to administer infiltration local anesthesia, I think that this will expand dentists' ability to provide efficient care for patients in their offices. Issue 4, specialists on the board. Alabama is one of 5 states that elects their dental board. We have a long history of specialty representation on the board. Dr. Al Coslin and Dr. Merrick were both oral surgeons who served admirably on our board. In recent years, Dr. Bobby Wells, an orthodontist, and Dr. Karen McCaffrey, a periodontist, were both outstanding on the board. I offer the opportunity to elect a board member with broad experience. As a general dentist and a specialist, I have practiced dentistry for 34 years and am familiar with all aspects of dentistry. I can promise you this: as a specialist on the board, I understand general dentistry. I was a wet-fingered general dentist from 1982 to 1987 in Tuscumbia, Alabama. I practiced dentistry to the fullest extent allowable at that time and had a very busy practice. I've also had the opportunity to see my dentistry after 5, 10, and 15 years. So I'm not quite as critical as I was when I was a young dentist who came out of dental school thinking that perfection was what we seek. Perfection isn't possible like dental school teaches you. The truth is that you're working on a breathing, salivating, moving, bleeding, anxious patient, and sometimes you do the best you can. I understand that, and as a member of the Board of Dental Examiners, I won't forget what I learned in general dentistry. Issue 5, unity. Dentistry faces many pressures from outside forces. Regulators under the guise of HIPAA and the Affordable Care Act seek to insert themselves into our practices. Any effort to divide dentistry into disparate camps of adversaries should be sharply repudiated when you vote for the board. Recently, the Affordable Care Act and the Civil Rights Division have looked at dentistry and said that we should be providing interpreters for any patient that comes in our office at our cost. Well, unfortunately, if you're seeing a Medicaid patient, the interaction may net you $28 and the interpreter may cost you $150. Sometimes the requirements of mandates of the government don't make good sense. There's a lot of things that are happening in dentistry that are different. You know, when I graduated, basically nobody went to work for corporate dentistry. Now 10% of the graduates go to work for corporate dentistry. I think it's a change, and I think it's something that we have to confront as dentistry and understand. As long as the young dentist that works in a corporate dental office is allowed to make the best decision for his patient based on what that patient needs and not what the corporation needs, I'm all for it. When the day comes that decisions are made for corporate profit that don't consider the patient's needs, I'm against it. So let me just make sure you understand that as dentistry changes, I'm willing to work to change with it. The Dental Practice Act will be opened within this next 5 years. I think you want somebody that will give thoughtful consideration to what dentistry ought to look like 20 years from now. I've had a good practice all these years. Dentistry has been good to me and kind to me. And I want you to know that a vote for Mark Mcilwain will reflect the fact that I owe a lot to the people out there that supported me. Dr. Charles McCallum, Dr. Howard Gamble, Dr. George Terrell, who I practice with, Dr. Mac Frazier, who I practice with, all these people have given to me knowledge and love. And I want to give back to dentistry the same. A vote for Mark Mcilwain is a vote for unity in dentistry and something that I promise you I won't embarrass you and make you regret it. Thank you.